It's late at night, you're watching your child, laughing, playing, lost in their own world, but something feels off. Not wrong, not broken, just different, and you can't quite name it. When you call their name, they don't turn. When you point, they don't look. When other kids play together, yours is somewhere else entirely. That quiet, persistent unease that only a parent knows, it doesn't lie. Today we covered 10 early signs of autism that most parents miss because they're small, ordinary, hiding in plain sight, and knowing them could change your child's life. Why this matters. The average age of autism diagnosis in the US is still 4 to 5 years old, even though reliable signs appear before a child's second birthday. Those lost years have real consequences. The earlier a child gets the right support, the better the outcomes in communication, learning, and independence. The first 3 years are when the brain is most plastic. Every month matters. The 10 signs. 1. They don't point and don't follow your point. By 12 months, most children point at things they want, but they also follow your point. When you gesture across the room, they look at the thing, not your finger. This is joint attention. Two people sharing focus on the same object. Kennedy Krieger Institute identifies absent joint attention as one of the strongest early autism predictors, detectable as early as 9 months. 2. They don't respond to their name by 12 months. You call their name, nothing. Again, nothing. This is almost never a hearing problem. Hearing tests come back normal. It's how social signals are being processed. UC San Diego researchers found that 80% of children later diagnosed with autism showed this sign in home videos recorded before anyone suspected anything. 3. Their eye contact feels different. It's not about absence, it's about pattern. Many autistic children make eye contact, but Yale Child Study Center researchers found they don't instinctively prioritize the eye region the way neurotypical infants do from as early as 2 months. You may not be able to quantify what feels off. Trust that feeling, then get it evaluated. 4. They don't imitate. Clap? A typical 10-month-old claps back. Wave? They wave. Imitation is the primary mechanism by which infants learn the social world, language, emotions, social rules. University of Washington research identifies reduced spontaneous imitation in the first year as a significant early autism marker. This is neurology, not stubbornness. 5. Language appeared, then disappeared. The child had words, said mama, said ball. Then, between 15 and 30 months, those words quietly faded away. This is autistic regression, occurring in 20 to 30% of children later diagnosed with autism. There is no benign explanation for a child who had language and lost it. This is always a reason to seek immediate evaluation. Don't wait. Call your pediatrician this week. 6. Play looks different. Typical toddlers use pretend play. A block becomes a car, a blanket becomes a castle. Autistic children often engage differently, lining toys up precisely, spinning wheels, sorting by color, focused on physical properties rather than narrative. It reflects a different kind of intelligence, systematic, detail-oriented, but it's a consistent early marker listed in CDC Autism Identification Guidelines. 7. They have intense, focused interests. It's not loves trains, it's memorized every model since 1955, becomes distressed if the train book is on the wrong shelf, steers every conversation back to trains within minutes. These interests aren't problems to fix. They often become lifelong strengths. But at this age, their intensity and exclusivity is a sign worth noting with your doctor. 8. Routine disruption causes extreme distress. For autistic children, routine is a physiological need, not a preference. A different route to daycare, the wrong bowl at breakfast, the response can feel disproportionate from the outside. Researchers have measured this. Cortisol levels spike measurably higher in autistic children during routine disruptions than in neurotypical peers. The distress is real and biological. 9. Sensory input hits differently. A shirt tag, a food texture, fluorescent lights, a crowded room. What's a minor irritant for most can be genuinely overwhelming for an autistic child. Every sensory dial turned to maximum simultaneously. The DSM-5 2013 officially added sensory processing differences to autism criteria. This isn't sensitivity to toughen up, it's a different sensory architecture requiring different accommodations. 10. They move differently. Stimming. Hand flapping, rocking, spinning, toe walking. Parents often try to stop this first, but stimming serves a real neurological function, regulating a sensory system that may be overwhelmed. Suppressing stimming doesn't address the underlying need, it removes the coping tool. This is not misbehavior, it is communication. The goal is to understand it, not eliminate it. What I need you to remember, not one of these signs means something is wrong with your child. Autism is not a disease. It's a different neurological architecture, a different way of experiencing the world. Autistic people love deeply, think brilliantly, and with the right early support, go on to live full, meaningful lives. But early support starts with early identification, and that starts with you. The AAP recommends autism screening at 18 and 24 months. If your pediatrician isn't doing it, ask. If something feels off, push. You're not an anxious parent, you're an aware one. If this video helped you understand something you couldn't explain before, share it with another parent. And tell me in the comments which sign surprised you the most, because your one comment might help someone else feel less alone.